Of this assignment is that the PTF must now factor the West African sub-region into its plans and activities to support Mr. President in his new role. I must add that the summit also set up ministerial coordination committees on health, finance, and transportation to coordinate regional efforts under the supervision of the champion. Today, the welfare of our frontline heroes, the health workers, came to the front burner. I'm pleased to inform you that the Federal Ministry of Health, working in conjunction with the MDAs and the health sector professional bodies, have signed an MOU for various allowances and other incentives. The full details will be unveiled to you by the Honorable Minister of Health very soon. I am, however, pleased to inform you that in addition to what the federal government is doing, the insurance industry has responded massively to the call for support. The Presidential Task Force has received a life insurance cover to all frontline workers on COVID-19 for a maximum of 5,000 health workers who are employed to fight against the COVID-19 pandemic. The premium in the sum of 112,500,000 for cover has been fully paid by the Nigerian insurance industry in line with the principle of no premium, no cover. The PTF wishes to thank the insurance industry immensely and calls on other sectors of the economy to rise up to support the efforts to fight COVID-19. I also call on our frontline health workers to double their efforts, just as we want to assure them of our determination to protect them. I informed you earlier in the week that the PTF has embarked on the assessment of the readiness of 9 states. These visits have been quite informative, and we have, as a consequence, strengthened our collaboration with states. The Presidential Task Force will be fine-tuning the directions and advisories in order to effectively guide the states and for uniformity of approach. I use this opportunity to once more commend the governments of all states visited for providing leadership and resources in their preparations. I also wish to use this opportunity to restate that food security and self-sufficiency remain important to our national life. I therefore urge all our farmers to begin to prepare for their return to their farms as the planting season is here. The Federal Ministry of Agriculture has put in place arrangements for access to farm inputs, extension, and other services. The Presidential Task Force continues to work assiduously towards presenting a report to Mr. President after considering all critical factors. Let me state that these are unusual times. We are in uncharted territories, and we need to forge ahead. As we work out our models, we also draw lessons from other jurisdictions that have had experiences to share. We shall, however, continue to pursue the strategy of aggressive testing, detection, isolation, contact tracing, treatment, and care. Finally, let me repeat my appeal to all Nigerians to continue to comply with all advisories. These are still the most efficient measures that can help us manage the ravaging virus. I now invite the Honorable Minister of Health to present his update and to most sincerely thank you for listening. Thank you.
Good afternoon, everybody. The Secretary to the Government of the Federation, honorable ministers here present, the leader of Labour, directors general, ladies and gentlemen of the press. Again, what I will say will reinforce much of what the Secretary to the Government has already put down. And as of today, 24th of April 2020, 981 people in 25 states of the Federation and the Federal Capital Territory have been confirmed to have COVID-19 infection. The 108 additional confirmations are as follows: 78 in Lagos, 14 in the Federal Capital Territory, 5 in Ogun, 4 in Gombe, 3 in Borno, 2 in Akwa Ibom, and 1 each in Kwara and Plateau. 197 persons have been successfully treated for COVID-19 and discharged home, while 31 deaths have sadly been recorded. Again, the high number of new cases is due to ongoing community transmission and also the very active and accelerated case search going on. From our test statistics, the most affected age group among the positives is the age group between 31 and 40 years, while the highest COVID-19 fatality rate is among the older generation above 50 years of age. We have now deployed COVID-19 starter packs to all tertiary health institutions and federal medical centers to complement what was earlier sent to each state. The starter packs consist of medical consumables and disposables to ensure that our frontline healthcare workers are protected, and also that there is synergy and collaboration between federal tertiary institutions and the host state health network. The COVID-19 capable National Laboratory Network, led by NCDC, has capacity to test over 1,500 samples per day in at least 13 laboratories, but the present utilization rate is barely 50%, since we averagely test about 600 samples per day, being the samples received at the centers. Efforts are on to increase the number of functional laboratories in the country. However, we need to meanwhile improve surveillance, sample collection strategy, and transport logistics to laboratories, and also reduce the turnaround time for tests. In our strategy, testing positive is followed by isolation and treatment as needed. Those who require no treatment still need to be in isolation in the interest of the public and their household. We urge all persons who have tested positive to comply, and for citizens to remember that anyone who has tested positive is not only just a private patient, but a patient of general interest. The COVID-19 virus has long since been declared a public health emergency of international concern. I wish to use this opportunity to applaud our frontline health workers again in the COVID-19 pandemic. Salute your courage and patriotism, but I urge you to protect yourselves as prescribed and use your personal protective equipment judiciously. Do not attempt to treat COVID-19 patients without using adequate PPE, or if your institution is not accredited to do so. This is important because we need to keep health workers safe at such a time and cannot afford the numbers who test positive to COVID-19 and have to go into isolation. Remain vigilant in the line of duty and maintain a high index of suspicion for this infection. I wish to appeal to all citizens to take the advisories that we give here daily and also repeat every time. Take these advisories seriously and adhere to the hand and respiratory hygiene as well as the social distancing directives. The use of a cloth mask or face covering when you leave your residence is recommended, as is the injunction to avoid mass gatherings and non-essential travels. I wish to restate the advisory given yesterday to reduce risk of community transmission by reducing all non-essential travel, especially long-distance travel. This will help to reduce the risk of carrying the virus from one state to the other. Today, we want to join the rest of the world to commemorate World Immunization Day, World Immunization Week. The theme for this year is Vaccines Work for All, and is dedicated to promoting the use of vaccines to protect people of all ages against diseases and death. While waiting for the vaccine for COVID-19, let us collectively adhere to all public health advisories. Finally, I emphasize again that to defeat the spread of COVID-19 requires collective and individual efforts. If you suspect you have been exposed to COVID-19 or anyone around you has been, call the toll-free NCDC numbers and the emergency number of 112 and 0800-97000010. Resources and real-time information on COVID-19 can be found in the social media handles of Federal Ministry of Health and the NCDC, the Federal Ministry of Health website and NCDC microsite. Please stay home, stay safe, take care of yourself, take care of your family, take precautions.
So, gentlemen and ladies of the press, Chair, distinguished members of the Presidential Task Force. Firstly, I'll join the Chair and the Honorable Minister by wishing all my Muslim brothers and sisters a Ramadan Kareem. So, COVID-19 has changed the way we live our lives in many ways. But one thing it hasn't been able to do is knock out our spirit as Nigerians. So I'd like to start today by really thanking everyone for your continued sacrifice on this journey and your continued cooperation with the lockdown as advised, instituted by Mr. President and many other governors across the country. As we traveled around the country over the last 4 days, we could really see how difficult it has been and how hard Nigerians have been trying to do their very best. We know it's a difficult journey, but we also know that we will eventually exit this stage and we start our normal lives, but that stage is still a while to come. And I ask for your endurance, your support, your patience. Lots of efforts are going on across the world to find new therapies, to find vaccines. Everybody is pushing very hard in this direction. So we need to stay firm and continue trying. We need really unprecedented levels of caution and to continue carrying out the preventive measures that we've advised severally on this platform. I'd like to really refocus and re-emphasize 5 of them, and really to ask everyone to support each other. when we talk about hand washing and respiratory etiquette, it sounds very difficult. And to be honest, it is difficult. Right now, I can't get back into my own household without being sent to wash my hands. And this is the reality. I don't rely on myself anymore to carry this out. Everybody knows in my household that they have to see me. So it's kind of supervising me to do the things I ask everyone to do, in recognition that none of us is strong enough to do this all the time. So I'd really ask everyone to find those checks and balances in our own lives, whether it's in our workplace or at home, to make sure that we do the things that we have to do. Physical distancing is very difficult, so we can't rely on ourselves either. So when you're on a queue and you're moving towards an entrance, hold back or ask other people to do the same, so you allow yourself some distance. This is not easy to do, but we all have to hold ourselves accountable for it. Face masks, as you can see, I had to take off mine to speak to you. I'll put it right back on after doing this. So we too have to hold each other accountable to doing this. It's come slowly, but now we have to accept that almost every time we leave our homes, we need to wear those masks. And it's not as if they're not important at home, but at home we're among a family, and any exposure within that family is difficult to control. So at least we keep whatever we have in the family, and when we go out, we prevent ourselves from spreading it. And spreading it you do by when you go out. And we're an outgoing society. We live outdoors, we walk outdoors, so staying at home and thinking about every movement that we make is very important, especially when we feel the need to travel. And I recognize how difficult this is at the moment. Many families I know personally have not been able to bury their dead, have rescheduled their marriages, have rescheduled their baptisms, have rescheduled everything they're doing. So in a way, it feels like life is in suspense, or we have suspended so many of the things that we hold very dear. So I am sure that everyone on this side of the table recognizes the great sacrifice being made by Nigerians. But we only have to encourage each other to continue till we get to the position where we can relax some of that. But to get to that place, we have to continue in the short term. And finally, we must remember that the most vulnerable people to this disease right now are the elderly in our society and those with some comorbidities. What do we mean by comorbidities? Some other illnesses. We must protect them. And right now, protecting them is, if they're living in the village, please leave them there. Support them with whatever financial resources you can by sending them home. But please, now is not the time to encourage travel. Travel is difficult anyway, rightly so. But really, if you have anyone that in your family, your society, in your church, whatever social congregation you have, these are really the most vulnerable in our society right now to this new disease, and we must protect them as much as possible. So now to conclude, we're all working hard to get to the point where we can relax some of these measures, but we're simply not there yet. So we ask you to join us, continue on this journey with us, amplify the messages that we are giving. There's no amount of risk communication that we can carry out through our different means that can get to every Nigerian. So we need every message sent out to be amplified several times more. We're very happy to have the leadership of the Nigeria Labour Congress here with us today. We really need your support in sharing these messages, encouraging our citizens to stay firm and join us on this journey. We will get to the end of it, but in the short term, we're asking you for some additional sacrifice as we continue to work hard to flatten the curve and see that we ultimately get out of this pandemic altogether. So thank you very much.
The Secretary to the Government of the Federation, Honorable Ministers, members of the Presidential Task Force, our esteemed visitors, ladies and gentlemen of the press, good afternoon. I would like to first of all start by saying that the PTF would like to assure the public that we continue to closely monitor the situation in Lagos, Abuja and Kano, given the increasing number of cases that are coming up. We are working with all the state structures, including the state task force teams and the state emergency operation centers, to ensure we control the pandemic sooner rather than later. In terms of grassroots sensitization, which continues to be extremely important for the control of this pandemic, we would like to reiterate the need for all state structures involved in the COVID-19 response to continue to engage directly with grassroots, particularly at the local government level, to ensure every member of society understands the pandemic we are facing. I would like to thank the National Orientation Agency and the various donor organizations that have been supporting the Secretary to the Government of the Federation, honorable ministers, members of the Presidential Task Force, our esteemed visitors, ladies and gentlemen of the press, good afternoon. I would like to first of all start by saying that the PTF would like to assure the public that we continue to closely monitor the situation in Lagos, Abuja and Kano, given the increasing number of cases that are coming up. We are working with all the state structures, including the state task force teams and the state emergency operation centers, to ensure we control the pandemic sooner rather than later. In terms of grassroots sensitization, which continues to be extremely important for the control of this pandemic, we would like to reiterate the need for all state structures involved in the COVID-19 response to continue to engage directly with grassroots, particularly at the local government level, to ensure every member of society understands the pandemic we are facing. I would like to thank the National Orientation Agency and the various donor organizations that have been supporting